Welcome. I'm Dr. Steve Tashiro. I'm a board-certified chiropractor and nutritionist, and I want to thank you for taking the time to view this DVD. I especially appreciate it because likely you or a loved one has peripheral neuropathy, and truly I feel for you. Because in traditional healthcare, the prospects for a person diagnosed with peripheral neuropathy are very bleak. Medically, peripheral neuropathy is considered irreversible and uncurable. And the only treatments are drugs that numb your brain to the pain, but do nothing to heal the nerves. Drugs that may initially work, but then they don't, and then more powerful drugs have to be prescribed. And all the while, nerve damage worsens, as do the symptoms. At the end of this road, you're looking at the use of a walker, wheelchair, possibly even amputation, and definitely loss of independence. But in spite of this grim picture, you've chosen to take this time to see and hear new information and to entertain a different possibility. So I commend you for keeping your hope alive, and I truly believe that the information we're going to share could change your life. First, a word about my background. I've worked in the healthcare field for over 37 years, and during that time I've had the privilege of helping thousands of people overcome chronic health conditions. My first degree in health sciences is a master's in clinical nutrition from the University of Bridgeport in Connecticut, 1985. I graduated from Palmer Chiropractic College in 1998, and I've been in practice here in Lakewood since 1999. And my primary passion and interest is offering life-changing care to people with chronic health conditions. So what is peripheral neuropathy? Literally, peripheral neuropathy means sick nerves in the extremities, usually feet and legs, although it can occur in the hands and arms. The two most common kinds of neuropathy are sensory neuropathy, which affects the nerves carrying signals from the skin to the brain and causes a loss of sensation, and motor neuropathy, affecting the impulses from the brain to the muscles and interfering with movement. What are the symptoms of peripheral neuropathy? In the early stages, the symptoms are primarily loss of sensation or numbness. Usually, in the early stage, there's no pain, and that's why it's often not diagnosed. These are called negative symptoms. Positive symptoms refers to pain, different kinds of pain, burning, tingling, cramping, sharp shooting pain, electric kind of pain, pain with walking, along with poor balance because you can't feel the ground, and often with the pain part, sleeping is difficult because that's often when the pain increases. As the nerve damage progresses, the number of nerve fibers actually decreases, and the fibers that are present become smaller or shorter. They shrink. The nerves that are present often are smaller in diameter as well as smaller in length. The numbness that occurs is a result of fewer nerves. The unpredictable pain occurs because the nerves that are still present start overfiring to compensate for the nerves that have shrunk, and that's called hyperalgesia. So what are the causes of peripheral neuropathy? Often there are multiple causes at work, and that's why it can be a very challenging condition to recover from. There can be a structural cause, for example, pinching of the nerves at the spine, where they exit the spine, because of a bulging disc, herniated disc, or arthritis or stenosis. There are numerous metabolic or chemical causes. Overall, the most common cause of peripheral neuropathy is diabetes. Approximately 60% of neuropathy is caused by diabetes. But prediabetes or insulin resistance can also cause neuropathy. Medications is another frequent cause, with statin or cholesterol medication leading the list. Neurology Journal in 2002 stated that use of cholesterol drugs or statins can increase the risk of peripheral neuropathy by a whopping 1,600%. Another common cause of neuropathy in terms of chemical causes is chemotherapy. The drugs used to kill the cancer also damage vessels, so there's less blood flow, oxygen, and nutrients to the nerves, and that causes neuropathy. In fact, neuropathy is the number one reason why chemotherapy patients abort their treatments. Along with these, there's a host of other metabolic or systemic causes, to include anemia, low thyroid, food sensitivities, especially to gluten. So what happens is, if you're sensitive to gluten and you eat it, your immune antibodies attack the gluten, and in the process attack the myelin, which is the fatty wrapper around the nerves, and damage the nerves. Infections such as Lyme's can also be a cause. And anytime you have inflammation in the body, that can affect the nerves. There are also neurological causes. Obviously, there's damage to the nerves themselves. So this leads to a decreased signaling from the nerves to the brain. And when that happens, there's a decrease in vitality of the brain and a loss of optimal brain function. And that's because the brain requires that stimulation from nerves in order to be activated and stay healthy. When this occurs, there's a change in the brain's normal perception of signals. So the pain is not only in the nerves, it's also in the brain. We refer to it as brain pain. All pain ultimately is perceived in the brain. So the first step in helping you is to ferret out the multiple causes. It may be 2, 3, or even more of these issues. Structural causes are identified with a spinal and structural exam, including x-rays. We identify metabolic causes by looking at your history, lab tests, and also questionnaires that we use. We do a neurological exam to identify if there are neurological causes. And this includes an evaluation of the peripheral nerves. We test your ability to feel a cool object, a vibrating tuning fork, heat from a hair dryer, or a light filament placed on the feet. Often, peripheral neuropathy patients have already had EMGs or nerve conduction tests showing the damage. It's more unusual, though, to examine a peripheral neuropathy patient who's already had a functional exam of their brain. The purpose of this exam is to identify what part of the brain has most been weakened and affected by the loss of signaling from the damaged nerves. So we call this a decreased frequency of firing or electrical vitality. It's like having a battery that has run down and gotten tired. This is what we refer to as a functional or soft lesion as opposed to a hard lesion. A hard lesion is something that would show up on an MRI or a CAT scan, like a tumor or aneurysm. So we're not talking about that. We're talking about a decrease in electrical vitality. Often the brain has been weakened because of the loss of stimulation due to decreased signaling from the damaged peripheral nerves. Some symptoms are often a clue that you have a weakened brain. Depression, anxiety, a loss of short-term memory, like you walk into a room and forget why, decrease in focus, attention, concentration, brain fog, learning disabilities, changes in mood, altered sensation, changes in handwriting. There are many others as well. But in addition to looking at your brain-related symptoms, we do a thorough functional neurological evaluation using brain tests, for example, testing a part of your brain involved in coordination, that's your cerebellum. We check the strength of different muscles because they're controlled by different parts of your brain. We test your cranial nerves, and there's numerous eye tests that give us a good window of understanding into how your brain is functioning. Neurological corrections, once problem areas are found, include procedures to stimulate healing of the peripheral nerves, the damaged nerves. Now, research shows that peripheral nerves can regrow at a rate of 1 to 2 millimeters per day when the proper stimulation is applied. That's about the width of a nickel. So that's a lot, and that's very promising. The way we accomplish this is through a number of different treatment procedures. One of them is called the Rebuilder. It's a device that is designed to rebuild and repair the nerves. It's a small box about like that that has wires coming out of it. At the end of the wires are pads that we place on the body. This was developed by a physicist who had relatives that had neuropathy, and it helped them, and now he's making it available to the professions. We also use infrared light therapy, a device called the Health Light, and this is very effective for especially the chemical-caused neuropathies like diabetes. We also use nutritional supplements specific to nerve tissue, and also topicals that are specific to healing the nerves through the skin. Brain-based therapy is the term we use for the procedures designed to wake up the fatigue areas of the brain. And this can include the use of therapeutic oxygen, balance exercises, vibration therapy, cold laser therapy, exercises with the eyes. We can even stimulate the brain with sound and smell. So there are many ways to wake up the tired parts of your brain. And for the chemical, systemic, metabolic causes, we use dietary management and nutritional, herbal, and homeopathic supplements to balance your blood sugar, reduce inflammation, address infections, correct anemia, support your thyroid and adrenals, and remove from your diet foods that you may be sensitive to that could be triggering an immune attack on your nerves. If a bad back is involved, we use standard structural procedures, including non-surgical spinal decompression. It's a table that separates the squash disc, opens up the joints, give the nerve room to breathe. We use therapeutic massage, spinal stabilization exercises, and chiropractic spinal adjustments. So hopefully by now you're realizing that although your symptoms may be localized in your feet, the causes and correction often include your whole body. We refer to this kind of care as comprehensive whole person care. And in my years of experience in healthcare, this is usually what's required to help people recover from a chronic condition like peripheral neuropathy. The fact that you're watching this DVD tells me that you are open to a different approach than what you've done to date. And that's good, because if you keep doing what you've always done, you can only expect to get what you've always gotten. And your future will be predictable, and it's not pretty. This is what I'm offering: a 2-visit case review and consultation. On visit 1, we'll do a thorough evaluation of your brain and peripheral nerves. Bring with you any prior lab tests, EMG, NCV reports, MRI reports. These, plus our questionnaires, will tell me if there's metabolic, systemic causes to your neuropathy. We'll do a structural evaluation, if indicated, and it's helpful if your spouse or significant other attends that visit with you. Then on visit number 2, after I've looked over all the information, I'll tell you if you're a candidate to be benefited by our program. And if you are, I'll tell you if there's additional lab tests or other tests that need to be performed, the results of the brain and neurological evaluation, and I'll lay out a very specific program of care. How many visits are required, how often, what we'll do, and what the expectations are for improvement, and, of course, what the costs are, including which your insurance may cover. It's very important that your spouse or significant other attend this visit. Our fee for this 2-visit case review and consultation is only $77. So if this is something you would like to take advantage of, call our office at 303-985-5540 and schedule that 2-visit case review and consultation. If you feel more comfortable meeting us in person first, give us a call to reserve a seat at our next free peripheral neuropathy seminar. We do these once per month in our office, and during the presentation, we demonstrate the Rebuilder and the Health Light and some of the other procedures we use. To schedule a seat at our next talk, just call that same number, 303-985-5540. But whatever you do, please do something. That's the only way you can possibly change your future. So I look forward to meeting you and adding value to your life.